Yeah, patients would know they need to have a hip replacement when the pain that they have is becoming intolerable or unbearable, and if the limitations from that pain are not acceptable in their lifestyle, and they want to have their quality of life be better from where they are. So hip replacement means replacing the ball and socket part of the hip joint. Generally requires about 45 minutes of a surgical procedure. You're up walking right away, bearing weight right away. Most patients go home same day and can recover safely and gradually over time. The operation itself is only 45 minutes, so it's not a long surgery, but it's still a fairly large surgery, but only 45 minutes for the operation. So generally patients are up walking the day of surgery, usually in recovery or nearby. They walk well enough to be home safely, and then they have a gradual recovery course over time where they're walking more and more, getting on their feet gradually and recovering over a few week period. So the great majority of patients are able to go home the same day. The patients who can't go home same day would be somebody who's not very mobile to begin with, and they just can't get around well enough to be safe at home, or if they don't have anybody at home to help them with their activities at home. But the great majority of patients can get home same day. Hip replacement longevity now has been much improved. I'd say at least 20 or 25 years on average, and for most patients, depending on what they do or circumstances, it should last a lifetime. The expectations for hip replacement would be no pain for the great majority of patients, functioning normal, able to return all activities that you want to do, and most patients rate their hip replacement as being normal or very close to normal. So it's a very, very successful, very good operation. Patients are very happy they had it done. So as far as doing both hip replacements, not many surgeons are now doing bilateral simultaneous hip replacements. They can be done relatively close together within a couple weeks maybe, and then you can recover both at the same time. So it allows for a shorter period of recovery and two different operations, but it's pretty rare to do both hip replacements at the same time. So for any patients who have chronic hip or knee pain, they may have hip or knee arthritis, which does require intervention. Not always surgical intervention, but if it's been a problem for long enough, should come in to have an evaluation. Towson Orthopaedic Associates has the best hip and knee doctors around. So if you need to be seen for a chronic hip or knee problem, give a call to Towson Orthopaedic Associates.